Hey, I'm Dr. Vidrine.
And I'm Jean with Louisiana Implants and Dentures here in Baton Rouge.
I have patients come in every day wanting to fix their smile, but they don't know how. There are many reasons a person may have a smile that they don't love, such as missing teeth, bad breath, gum disease, bad dental work, loose teeth, and that's just to name a few. There are many routes you can take, including dentures, veneers, or what we often recommend, dental implants.
What are each of these options? What do they look like? How are they different? And who is the right candidate for each? Today, we're going to be answering those questions. So to start off, let's talk about what each of these options are. So first, what are dentures?
So I actually have a denture model right here. As you can see, it's a full plate that covers either all the top or all the bottom of your mouth, replaces a full set of teeth. They come in and out. You have to take them out every day. And they work okay, but they're not really a good long-term option. They have some drawbacks with eating and smiling and staying in and things like that.
Okay, so that was a little bit about dentures. So veneers. I've heard of a lot of celebrities and influencers having this procedure done for their smile, but I never really understood what the procedure is and what veneers are. So what are they?
So veneers are essentially when you shave down a part of the tooth just to change the looks of that tooth. It can change shape, it can change color, and they look really nice, and that's why people get them.
Okay, so basically it just goes on top of your natural tooth.
Exactly, it just covers the front just to change how it looks. It's really important that the teeth that it goes on are in really, really good condition. They often can't have other work, and they definitely can't have any cavities or anything like that going on.
Okay, so veneers are basically caps that go on your natural tooth, but like you mentioned, you'd have to have a strong natural tooth for it.
Right.
Okay, so going along with that, I've also seen some really cool before and afters of smiles that were transformed by dental implants, but I'm not really sure what that is.
So dental implants are really meant for missing teeth. You can only put them there if there's no tooth there, whether you have broken teeth, bad teeth, teeth that need to come out, or teeth that are already missing, they can replace those. And one of the benefits is that you have more versatility with how you can change the shape, change the position. We can even fix other dental problems like the bite or anything like that, and they look great. So that's one of the big benefits over veneers is you can do a little bit more with them when you rebuild that foundation.
Okay, so there are teeth that are permanently in your mouth.
Right, they stay in, they don't come in and out. You basically can treat them like your natural teeth and use them in that way. So whenever we're considering, do we need veneers, do we need dentures, do we need dental implants, we really want to split these into two categories so we know, do we need to keep all of our teeth and build off of that, or is it time to move on, take some teeth out, and kind of rebuild that foundation and work from there?
Okay, so how do you know whether or not you need to remove all your teeth?
There's a couple of different scenarios. So sometimes you just know. Teeth are broken, you've been dealing with it for a while. Whenever you're having problems functioning, whether it's chewing, you don't want to smile anymore, then it's probably time to start thinking about a more comprehensive option like a denture or dental implants. Sometimes there's a little bit more of a gray area. Say you're a mom, you've been taking care of your kids for years, maybe you've been taking care of your parents too, and it's time for you to take care of yourself. You go, you get a treatment plan, and it's 9 fillings, 3 crowns, 3 implants, root canals. You go to the orthodontist, they say it's gonna be 3 years, the whole thing's gonna cost $40,000, then you need veneers after on top of it. And your other option is dental implants. Maybe it only takes a few weeks. Maybe it only takes a couple months and it's a little bit cheaper. This is a time where you might wanna weigh the two options and see what's best for you. One thing to note, here at Louisiana Implants, we always recommend the treatment plan best for the patient. So if we believe that saving your natural teeth is the best option for you, that's what we're gonna recommend. With that said, there are some patients who choose the convenience of full mouth dental implants over spending 4 to 5 years restoring their natural teeth. And in that case, whether or not to extract all your teeth is a choice that should be made after discussing with a dental professional like myself or another one that you're comfortable with. After hearing that, if you're interested in keeping your natural teeth, that's great. That's not a problem for us at all.
Okay, so say after hearing that, you're interested in keeping your natural teeth. What option is best for people who want a perfect smile, but they also want to keep their natural teeth?
So if you want to keep your natural teeth, your options are veneers, crowns, maybe fillings. Something to keep in mind again is that you need a really good foundation to do a lot of those things. They may not be an option if you have broken teeth, bad teeth, missing teeth, things of that nature.
What about if I'm missing 2 front teeth? Is that possible?
So in that case, you would have to do dental implants on those front teeth to replace those missing teeth.
So just so I understand, veneers are only for people who have solid natural teeth.
Right.
Okay, so what about people who are missing a few teeth or missing all their teeth or need to get all of their teeth extracted? What are their options?
So that's when our dentures and our dental implants come into play. If you're just missing a couple teeth, single implants may be a good option for you. This is a good example of a single implant. This is the implant piece, and then you have your tooth that goes on top of it. At that point, it doesn't come in and out. You can use it basically just like you have a tooth again. If you need a little bit more extensive work, then you're talking dentures or your full mouth dental implants. Dentures, like we talked about earlier, this is a denture. It covers the whole top. It comes in and out. Teeth can break off of it. It's not made of a super strong material. It's made of acrylic. So they tend to start having issues a few years down the road. Dental implants are made out of much stronger materials. This, for example, is a full solid piece of zirconia, and it uses the same implants as the single teeth, except they're basically just all connected together into one piece, so they're a lot stronger. Doesn't come in and out, you can eat anything you want with it, and it looks great.
Now let's talk about the difference between these 3 options overall. What's the difference between veneers, dentures, and dental implants in terms of longevity?
Yeah, so the first most important factor is going to be how well you take care of it. Really important to keep everything clean, whether it's veneers, dentures, implants, it doesn't matter. Still have to clean everything, do your part to make sure it lasts as long as possible. The difference between the dentures and dental implants, first of all, material. This denture is made of acrylic. It's a lot weaker. Teeth can pop off, it can crack, you can drop it and it breaks because it comes in and out. Dental implants, they're made of a solid piece of zirconia, doesn't come in and out, so you're never gonna drop it and crack it. The zirconia is much stronger. They don't really wear. You're not gonna break a tooth off. It's just a much stronger product that's meant to last a lot longer. Dentures, you can expect to come in within 5 to 7 years. You'll probably have a broken tooth, might crack the denture, it might not fit anymore. Those things aren't gonna happen with dental implants.
So it sounds like ultimately it just depends on the patient and the upkeep that the maintenance that they do for their
yeah,
teeth.
When deciding between the two, really what it comes down to, the best option you can afford is gonna be the best option for you because the dental implants are so much better than a denture. If it's something you can do, there's no comparison between the two.
So if I'm a patient, do I have to worry about the foods that I'm eating with these 3 options?
Yeah, absolutely. Dentures they stay in by suctioning in your mouth and they're meant to come out. You have to take them out. So whenever you eat a harder food or a sticky food, they can move around. They can pull out. Even sometimes, some patients, if their dentures don't fit very good, it can even come out while you're talking. It doesn't even take chewing. The dental implants, you can eat anything with these. It's not gonna come out, it doesn't move around. You could chew on ice if you wanted. We don't recommend that, but you could and it would be fine. Sticky foods, you could chew on a Jolly Rancher with the implants and it's not gonna move. If you tried that with a denture, they would probably stick together and you could pull them out in one piece. It's a lot different and the options you have to eat are a lot different.
Okay, and then with veneers, you can eat whatever you want since they're caps on your natural teeth?
Usually veneers, it's not much of an issue. You can eat whatever you want. Sometimes you have to be a little careful because they're just stuck on the front, so they can pop off if you bite into something hard. That happens on occasion.
Okay, so what about how they feel? Is there any difference in feel between the following 3 options? Which one's more comfortable?
So your veneers probably feel the most natural because they just go on the front of the tooth. It's really not changing that much. Just a little bit of shape, sometimes color. But like we said before, those are kind of a different subset of patients than the dental implants. So when you go dental implants versus dentures, there's a really big difference. Dentures are big, they're bulky, you have to get used to talking with them. It feels like there's a lot going on in your mouth. They get sore spots. Sometimes your gums will shrink, your bone will shrink, and they don't fit as good, so now they're loose. Then you have to go get them adjusted, and sometimes you need a new denture. That doesn't really happen with dental implants. Those feel a lot better, feel a lot smoother than the dentures. You adjust to them a lot more quickly. People come in and within 24 hours, they're talking like normal, can't even tell there's any difference. There's a really big difference between those two.
Okay, so it sounds like dental implants would be the much better option than dentures.
Yes, far and away, there's no comparison between the two from feel, what you can eat, how they look, everything. Dental implants are definitely superior to dentures in every single way.
So which of these three options would give you the realest look, the most natural looking smile?
The realest look is going to be equal between veneers and dental implants. Again, different patients. But between dental implants and your denture, the realest look is definitely going to be the implants. One of the main differences is that for a denture, everything's pre-made. The teeth are all pre-made. It's not really customized. You kind of get what you get. There's different teeth, but you just throw in there whatever you think will look good. The dental implants is a lot different. It's all done digitally. We invest in the best quality technology that's out there so we can design smiles. We can really give you the smile that you've always wanted. We take your input into account, shape of the teeth, color of the teeth, all those different things. And we have doctors that are in the lab all the time, checking everything that everyone's doing, making sure that that communication from what the patient wants to what the lab is doing is always there. We can customize the teeth, the shade of the teeth, color, everything. Make them super white if you want them or super yellow if you want them. We can put gaps between the teeth if you had a gap your whole life. Everything's custom made. We can even do a couple of sets of temporaries if the looks you just really want something specific. We can even do that for you. So we go to great lengths to make sure that the smiles are perfect how the patients want them, and we'll do whatever we need to do to make that happen.
Now I'm sure a lot of you that are watching this are wondering about price. So let's talk about the price of the three options.
Okay, sure. So with your veneers, usually a full mouth, you're probably looking in the range somewhere $30,000, $35,000. With your dentures, it varies a lot more. It's based on how many teeth you need to get pulled for one. So if you have no teeth, you could probably expect to pay somewhere in the $3,000 to $4,000 range. If you have a full mouth of teeth, that might go up to $7,000, $8,000, $9,000. Another thing you want to consider with dentures, they're really not going to last forever. At some point, you'll probably have some teeth pop off. You might break it. When things like that happen, you're going to need a new set. So that's something you really want to factor in for the long term as well. For our dental implants, the national average is somewhere in the range of $25,000 to $30,000 for just the top or just the bottom. Now, we're a lot more affordable here, and at Louisiana Implants and Dentures, we're really passionate about that. It's really important to do the best quality work at the lowest possible price. We have patients that travel a few hours all the time because we're competitively priced, especially from the Mississippi area, some of the parts of Alabama. Dental implants are expensive, I get that, but the effect they can have on your quality of life makes it absolutely worth it, and we can work with you to help you afford these prices. That's a little bit about the difference between dentures, veneers, and implants.
We hope this video is helpful in determining what option might be best for you. If you did find the video helpful, then please give it a thumbs up and subscribe to our channel for more content like this.
If you have any questions about the process, leave a comment and we'll be happy to help. If you live in Louisiana or Mississippi or anywhere else and are interested in a complimentary consultation, please visit our website at louisianaimplants.com or click the link in the description below.
We're also happy to do virtual consultations for those who live further away.
Again, I'm Dr. Vidrine.
And I'm Jean, here with Louisiana Implants and Dentures, and now you know more about your options for missing teeth.